So my presentation is this new reality of our healthcare systems. I would start in the next slide to show you what are the learned lessons from this from my presentation, and mostly it's about uncertainty versus control. We know for sure that our healthcare systems were characterized by control, and this COVID crisis gave us this level or high level of uncertainty in our activities. Even though we knew that our system was in crisis due to several factors, where medicine plays an important role as a solution, actually our system was not working well enough as we wanted to. But anyway, this crisis increased our problems, and mostly by the level of uncertainty that gave us. So let me start for these learned lessons, and I will elaborate my presentation during my 7 minutes. First one is that the way that the COVID-19 crisis is affecting hospitals is quite profound. Not only hospitals, but all the care system. The other one is the health system capacity, and we realize this is completely dependent on individual and community behaviors, and not only in individual behavior. So we understood that at some point our healthcare system was mainly focused on the individual behaviors, for example, in having healthy diets, exercise, and actually we realized with infectious diseases, with this emergent infectious disease, that it's actually we are dependent in each other to control this epidemic. The other one is that need to redefine healthcare provision to deal with COVID-19 patient needs. And actually we achieved for COVID-19 something that we wanted to develop for several years for several diseases, is that the system was designed to focus on the COVID-19 patient needs. And I will talk a little bit about this. The other one is this development of this integrated center and tailored patient care for COVID-19 that is quite connected with the last one. The fifth is the consequences, is that actually the system is worse than before with the COVID-19, when you need to realize this. And these two scenarios, do nothing or regain control. So next. So actually these infectious diseases, these respiratory infectious diseases change the way that we provide care. And actually even for the hospitals, it made a quite profound change, as we have seen some sort of scenarios that we didn't see since several decades ago. Can you, next? And we've seen these war scenarios, for example, in northern Italy, in Spain. Fortunately, other countries didn't were so affected, but actually we see that we are quite frail in facing of this kind of pandemic, and we realize that we are not so strong as we were thinking, and actually we counted on behaviors and population behavior with this physical distancing measures, these confinement measures, more than in the healthcare system. Next slide, please. So actually this shows us that we are very, very vulnerable, that hospitals are not in the center of healthcare system, the individual is, and the response or the level or the quality of the response from the healthcare system is completely dependent on the individuals. And I think this is going to stay in the next few years and will influence the way that we see our system, and even the way that we think our hospitals, not as standalone institutions, but also as an organization that works in a community that has complete dependence on the community and needs to work with other partners. Next slide, please. So actually also, we redefined the way that we provided care. This was quite tailored to COVID-19 patient needs. There are some measures that I show you here, from mental health to the retraining or purposes of healthcare workforce, a new organization, even this high pressure on acute and ICU capacity. But not only because we needed to maintain essential services, and we are getting some data now that is showing that even our over focus on COVID-19 had affected care for other conditions. Next slide, please. So actually, we see that we needed to have this new patient care or patient model of care, where we tailor care from asymptomatic, mild cases, moderate cases, severe cases, critical cases, and where just 6 to 10% of the patients needed to get hospital care. And most of the patients that were symptomatic or mild cases, where we could treat patients at home as a common flu, but where IT and mostly eHealth played a very relevant role on monitoring patients at home, following their symptoms, not only actually COVID-19 infected patients, but also patients that were in quarantine and were presumptive TB cases, or sorry, COVID-19 cases. And actually, even IT played also a role in the discharge of patients from the hospital when we started to discharge them, even before they have negative lab exams to confirm that they were cured from COVID-19. So the apps played a role, and home services played a very important role in dealing with COVID-19. Next slide, please. So in short-term consequences, we have seen a need in the healthcare workforce. We are still analyzing this, even mental health disorders due to confinement and also human resources burnout. We have seen that some sorts of burnout in our healthcare workforce. What we are going to see in the short term is this increase of demand of healthcare services due to unemployment and poverty, that there is a consequence of the economic downturn, but also the need to increase our capacity due to the cancellation of elective activity. And actually, we don't know how we're going to deal with this. But we know that we are going to have more needs, and we need to answer those needs. The other one is that actually our healthcare system is more expensive at this point. With PPEs, regular testing, cleaning routines, we increase our costs, and we have a reduced productivity in this short-term scenario. Next slide, please. So in the medium term, we have some opportunities that mostly is to developing this dual system in this next year, before we have an effective vaccine, to manage this dual system, where we are going to need to balance this capacity for COVID-19 and all the other conditions. So we are going to need to catch up the canceled activity. We will increase utilization of eHealth. Actually, during the crisis, eHealth played a very important role on mostly in a not organized fashion or way, but it played a role mostly in medical appointments and the follow-up of patients. But we need to organize our eHealth, but anyway, it will play a very important role in the future. We need, and we need to be quite careful with this, that we need to maintain the flexibility for second waves, not needing to be countrywide second waves, but even local or regional second waves. But then begin control, I really believe that predictive analytics will play a very important role, and all this new way that we need to provide care based on, of course, personalized medicine will play a very important role in the future, knowing that in the next year the regain of control is regain our level of our capacity to predict what will happen, how we will organize. That's the way we are going to regain control of the overall system. Next slide, please. Anyway, during this very, very interesting webinar, we are going to see different scenarios, knowing that actually, to know that we are really in a new world, and there is a post-COVID period where we will need to provide different ways of providing care. And I really believe there is a very interesting window of opportunity to change the way and to improve our healthcare system. Thank you.